As you heard in the introduction, I am based out of Saskatchewan now and had a good chuckle myself listening to Mike's comments. I'm surprised he made it out of Saskatchewan alive with some of his comments at the Stock Growers Association. So you got some good razz in there, I'm sure. I'm here today to talk about determining an effective vaccination protocol in our cattle herds. And building a little bit on what Mike said, this can be a really big part of the good things that we're doing on our herds, part of our story in disease prevention. Disease prevention has been a foundation of our herd health programs for years, and it's just going to continue to gain importance as we shine more of a light onto our production practices. Why do we vaccinate? What are we trying to do when we're giving that vaccine to that animal? We need to think about more than just the act of giving that needle, giving that shot to our cows, giving them the vaccine. Beyond that, we're really trying to build optimal immunization protocols. So what we're talking about here is building an entire series of vaccines, a protocol of vaccines that we're working on building the strongest immunity in these animals, not just what vaccine we're giving at that one time. To talk a little bit about how vaccines work, when we give that dose of vaccine to that animal, we give them that injection, that vaccine does something in the animal's body to resemble the disease which you are vaccinating for. What happens when that animal's immune system gets the signals that the pathogens that we're vaccinating for are being represented in the body? It stimulates that immune system to mount a response. So basically that immune system is going to go through just like it's trying to fight off the virus or the bacteria which we're vaccinating for. So that the next time that pathogen, that virus, that bacteria is introduced to the animal, the immune system has a memory of what to do to fight it off. So it more efficiently and more quickly is able to fight that disease than an animal that is unvaccinated. So a couple important points come from this, that when an animal is given a vaccine, its own immune system has to respond, and that takes both time and resources from the animal, so that we need to think about this when we're developing our vaccine protocols to ensure that there's sufficient time to vaccinate and that the animals are in optimal conditions in order to let that vaccine work as best. So when thinking about developing a vaccine protocol, if we all wanted to go for coffee really early today, I could sum this up in one slide. Go talk to your veterinarian. They are going to be your best resource for developing a protocol for your herd, for the pathogens specific to your area and your herd, and in targeting the exact goals of your animals. So this will always be the place we'll come back to, is we always recommend going to speak to your veterinarian to tailor your protocol exactly to your operation. But I might as well, while I'm here, give you a few points of broad things that we can consider when developing vaccine protocols. First of all, we want to think about all the different groups of animals on our operation and how their vaccine requirements might differ. So we think about starting with our calves. These are animals that can present unique challenges for vaccinations, but are also a very important group to build the foundation of our herd health. These are animals that will become our replacements. They're going to be the product that we're sending out to market. It's a really important group to focus on in our herd health protocols and in our vaccination. So I mentioned some unique challenges. That particularly applies to calves at birth and both really young calves. We'll talk a little bit more about that. Some other common times we may vaccinate calves would be at spring turnout time, and then in the fall at weaning time. And even then, we're going to split out those calves into a couple different purposes. There's going to be those calves that are going to market, those we're keeping back as replacements. Those animals are going to have different purposes, different needs for our vaccine programs. After that, we're talking about our cow herd. Again, our focus for our vaccinating is going to shift in this group of animals. And something we sometimes forget about is the bulls. They're a very important part of our overall herd health, and we shouldn't forget about them when we're developing our vaccine protocols. Beyond the group, we want to think about those pathogens. What are the diseases and the bugs for which we want to vaccinate for in our herds, in our different areas? In our cattle vaccines, we'll commonly think about our viral vaccines as being a real base for that. So that's going to be 4 or 5-way vaccines, Bovishield Gold 5, FP5. Any of those viral vaccines are going to be one of the most common vaccines our cattle are going to receive. One of the other really base broad vaccines that most animals are going to receive at some point in their life is going to be a clostridial vaccine, and those are our 7 or 8-way vaccines. Beyond that, there's many different pathogens which we would want to vaccinate for and for which vaccines are available. But these are things, again, coming back to talking to your veterinarian, that you're going to want to work specifically on which of these are a concern in your herds in your geographical area. For example, in my time in practice, I was not even aware that the rabies vaccine was licensed for use in cattle. That's going to be different in some areas, such as Ontario, where rabies may be more prevalent and it may actually be a concern for vaccinating. Probably you guys aren't going to worry about vaccinating for anthrax out here at this time, but in the past few years in Saskatchewan, that has become a real concern. So it's most appropriate to work with your veterinarian who has their boots on the ground at your farm and is going to be able to address the geographical challenges in your area and in your specific herd. We also want to think about the timing of our vaccines, and I mentioned earlier that those vaccines are going to take time to work. We want to make sure that we give the vaccines in enough time so that they offer protection when it's most needed. The other thing to think about is that we're getting the best protection when we need it the most. And we often want to vaccinate at a time when we're running animals through the chute already, or when we're doing other procedures, or when we are vaccinating, we want to give as many vaccines as possible at one time to decrease handling stress on the animals. We have to think about, though, that the best time to vaccinate, where it's going to be most effective for our herds, is not necessarily going to be the most convenient time. So we need to think about when we need that peak immunity and when we can give our vaccines so that they're going to have the strongest immunity at the time we need it the most. Every vaccine that you give is going to have something called a duration of immunity. So every vaccine you give is going to offer protection against a disease for a certain amount of time after it's given. In most cases, we're only going to be vaccinating our animals once a year, and so we just inherently assume that that vaccine is going to offer protection or is going to have a duration of immunity of at least that entire year. That's not always the case, particularly for vaccines such as intranasal vaccines, which we're giving up the nose, or for many killed vaccines, may not have demonstrated duration of immunity for that full year. So if we break it down to what are some of the key points, as always, I'll always come back to this message: working with your herd veterinarian is going to be your best bet to developing the most effective protocol for your herd. That protocol should be written down so that you can reference it when you need to, and it should be reviewed and updated at least once a year with your veterinarian. You want to think about what pathogens are most likely to affect what group of cattle on your operation and target that vaccine program against those pathogens. And in order to have that optimal immunization, the best immunity possible, you want to vaccinate your animals at the correct time. Let's start off a little bit more detailed information here with talking about vaccinating young calves, which I mentioned presents some unique challenges with vaccines. When we talk about vaccinating calves, we really have two goals in mind. For one, we're looking for specific disease protection so that those calves don't get sick. Secondly, we're looking at setting up the immune system of those calves for the best protection possible in the future. This is both to protect those animals from disease in the future, as well as for our female animals particularly, to set them up for reproductive protection in the future. We'll talk more about that when we get to the cows. So with calves, at birth, we have to deal with something called maternal antibody interference, and this is the only time in a cow's life we're going to have to deal with this. What happens when a fetus is developing is that no antibodies that cow has, so all of her immunity to disease in antibody form, is not able to cross the placenta and get into that fetus. So when that calf is born, it's not going to have any protective levels of antibody against disease. It's going to look a little bit like this. So if along the bottom here, we're looking at the length of time, and up here, we're looking at the level of antibodies that we're dealing with over time. So when a calf first drinks colostrum, that's when it's going to get its initial level of antibodies that are going to offer it protection for that first part of life until it can start producing its own antibodies. So that's going to look something like this. Those maternal antibody levels are going to rise quickly after the colostrum is given, and they're just going to degrade over time because the calf can't produce any more of those maternal antibodies. That's just what comes from the mother's colostrum. Now we have here what's called the permissive titer for immunization. That's basically a fancy way to say that the antibodies have to be below this level before a traditional injectable vaccine is going to work. At this time period here, while those antibodies are still above that level, the antibodies that calf received from the colostrum is going to prevent a traditional injectable vaccine from properly working. The antibodies are going to interfere with the response to that injectable vaccine. So ideally, we want to vaccinate as soon as that calf's antibody level gets to the level where the traditional injectable vaccine is going to work. Once that calf is vaccinated and can respond with its own antibodies and build up its own antibodies, we will see a strong response to a vaccine such as this. Now, in that period of time, we're going to see what we call a window of susceptibility, where that calf, the maternal antibodies have decreased enough that it's not fully protected from disease, but the calf's own antibody levels aren't high enough to fully protect it from disease. So that's a critical period of time where we'll often see illnesses in our calves, and it's often paired with other stressful events, such as turnout or handling. So what can we do to get around this maternal antibody interference and offer some protection within that window of susceptibility? We can vaccinate calves by a different method, such as going intranasal. And as I mentioned, that's giving the vaccine up the nose. There's certain products that are licensed for this, one of them being Enforce 3. It's a very common intranasal vaccine on the market that is used for 3 common respiratory viruses. Oh, excuse me. So if we come back to this chart, Enforce 3 works even when these maternal antibodies are present. So we can give Enforce 3 to a very young calf and offer them strong protection throughout that window of susceptibility. Another phenomena that we have to deal with in these very young calves is something called dominant antigen interference. Basically what this means is that the immune system is going to preferentially respond to the biggest threat that it's presented with. So when you're giving multiple vaccines at once, if the immune system sees one of those pathogens as being more dangerous than the others, it might respond more so to that pathogen than the other vaccines being given. This has been demonstrated in seronegative calves only, so this just means naive calves that have not been vaccinated before. And it happens when you're giving multiple vaccines or multiple pathogens in one vaccine at the same time. The most common demonstrated incidence of this is going to be with IBR virus, given at the same time as Mannheimia bacterin. So this is one of our most common causes of calfhood pneumonia in our beef calves. And IBR is a very common virus that exists in high levels in the wild and within our cattle herds. When you vaccinate a naive calf with both of these components at the same time, that calf is going to preferentially respond to the IBR. So you're going to get a very strong IBR response, but it's going to dampen that response to the Mannheimia vaccine. We're not going to see as strong of immunity built to that particular bacterin. We know that this occurs with IBR and Mannheimia, And we know that IBR is what we call an immunodominant antigen. So it's a big threat to the immune system that the immune system is going to choose to respond to over other things. There has not been other published work done looking at the effect of IBR on other vaccines given at the same time, but it is possible that this occurs with more than just Mannheimia. So if we think about it like this, when we give that vaccine to a very young calf, not only are we dealing with these maternal antibodies here, so the orange dots in here, we're also looking at these dominant antigens, which can interfere with the response to certain components of that vaccine, as well as just general stress hormones that we're going to see in that calf that can interfere with vaccine response. So what can we do to overcome dominant antigen interference? There's a couple different products within the Zoetis product line that can be used in these cases. Inforce 3 I already mentioned as that intranasal vaccine. This has been shown to overcome dominant antigen interference by that calf responding to IBR at the level of the nose first. So if we give Inforce 3 first, we can give a traditional injectable vaccine at the same time as a Mannheimia and not see that immunodominance effect. The other product that we have that has been specifically crafted to get around dominant antigen interference is Bovishield Gold one-shot. This is our combination vaccine. When we developed it, it was specifically created to get around this effect so that we see very good IBR response and Mannheimia response with this combo vaccine. So these are two options we can use to get around this dominant antigen interference effect. Coming back to some key points of achieving optimal immunity in these very young calves. So we know that calves are born without protective level of antibodies. When it hits the ground, it has no immunity to disease. We know that maternal antibody levels can interfere with our response to traditional injectable vaccines, and we can think about that when we're developing our protocols in order to get around that effect. We also know that these dominant antigens can interfere when we're giving multiple vaccines at once, and again, we have options to get around that when we craft our vaccine protocols. So moving on to vaccinating cows. Our main goal when we're vaccinating our cows is really going to be to protect that calf in a lot of cases. So when we are vaccinating our breeding animals, we want to ensure that for our viral vaccines, we are using an FP product, and that's most commonly going to be in the product name. So Bovishield Gold FP5, for example, specifically created for breeding animals to offer fetal protection. That's what the FP stands for. Fetal protection is an added level of protection for that developing fetus. What exactly are we trying to protect that fetus against? And there's a couple of really important ones here. One of the main viruses which we're trying to protect our developing fetuses from is BVD. We're going to talk about this one for a little while. As we think about the days of a cow's pregnancy, so starting here, moving on to 6 months and beyond, if a cow gets exposed to BVD virus within her first 40 days of life, if she gets exposed from another cow or in the environment, then we can see fetal death, which sometimes just shows up as infertility. A lot of us aren't preg checking before 40 days, and so we're just going to see open cows at preg check time. Those animals may have actually gotten pregnant and lost the fetus at a very young age. If that cow is exposed to BVD during about 30 to 125 days of pregnancy, we're going to get what we call a persistently infected calf. I'm going to explain that in the next few slides. Then from 100 days to about 180 days of pregnancy, if she's exposed to the BVD virus, we can see birth defects. That can include decreased brain development or ocular anomalies, several different effects, a misshapen calf when it's born, something that's not going to be saleable for us and often is not conducive to life. And anywhere from about 4 months on, we can see abortions due to BVD virus exposure. So this is really something that we need to address throughout the entire pregnancy. We need very strong immunity to BVD throughout that pregnancy, particularly in this persistently infected time period risk. So what exactly is persistent infection with BVD? These are also commonly referred to as BVD PI calves. As I mentioned, this happens when that cow is exposed to BVD virus within 30 to 125 days of the pregnancy. So there's our cow growing her calf. The BVD virus comes in, as I mentioned, from other animals, or she may be exposed to it in the environment. And that virus crosses the placenta and goes into the fetus. Now, after this time period, that calf's immune system is going to develop. And when the calf's immune system develops, it looks all around itself and it says, everything that's here must be part of me. So that immune system learns not to mount an immune response to everything that is present as it develops. When the BVD virus is there, the calf assumes that it's part of itself, and it learns not to mount an immune response to BVD. That virus stays with the calf until it's born, and it stays with the calf throughout its entire lifetime. That calf will be a source of significant shedding of that virus within your herd. So it can not only shed the BVD virus to other calves and cause illness in them, but it can shed the BVD virus back into your pregnant animals and infect their fetuses so that more PI calves are born. This PI calf is going to grow up to be a PI cow. She's always going to carry that virus with her. She's very generously going to share it with her developing calves as well. So when a cow is PI, that calf will always be exposed to the BVD virus in that 30 to 125 days of gestation. That PI cow is going to have a PI calf every single time. You could see how this could propagate very quickly within your herd. Now you may think, well, if she has the virus in her, certainly I'll know what she looks like. Would anyone care to venture a guess as to which of these calves would be PIs? Dwayne Bryant. I'll pick on you. So Dwayne's answer was all of them. He's very likely correct. I actually don't know the BVD status of this animal, which is often the one that people pick. I do know for certain that these calves are PI animals. Over 50% of PI calves will go on to the feedlot and finish out normally with the rest of their herd mates. So we really don't know who those PI calves are just by looking at them. If we're looking at the cost of having a PI in our cow herds, the average cost of one PI in a beef cow herd is about $20 for each cow in your herd. So it's going to have a significant effect because that BVD virus will keep circulating in your herd. It's going to cause immunosuppression. It's going to have effects on your reproduction and will continue to propagate itself throughout your animals. So when we think about vaccinating cows, BVD is a really big one that we're going to want to look at protecting that fetus from and ensuring our cows have good immunity. We also want to make sure that that protection is strong throughout that entire pregnancy because BVD will have effects throughout the entire gestation. Another important virus that we're concerned about is IBR. IBR virus main effect on fetus is abortion. And this can happen at any time in the gestation again. It's most common at about 4 to 9 months of age. And a little bit later in the pregnancy, we will occasionally just see weak-born calves. So they will actually be live when they come out, but they are infected with the IBR virus. Some will go on to thrive eventually, but some of those calves will just go on to die soon after they're born. So another really important one that we need to think about. In naive herds, when we see those animals exposed to IBR, we can see 25 to 60% of your cows abort if it's a naive herd and we have an abortion storm going on. I've dealt with cases of these in my career. They are never fun, never pretty. So again, this is another virus. We need to be very cognizant about offering good protection throughout that entire gestation period. Those are the two main viruses that we're going to look at protecting against with that fetal protection vaccine. Pregnancy status is another factor we're going to want to keep in mind when we are talking about vaccinating our cow herd. As I mentioned, we want to be very cognizant of offering good protection to our animals throughout that entire pregnancy, but we also want to think about the pregnancy status of those animals when we vaccinate them. If we are not carefully creating our vaccine protocols in vaccinating pregnant animals, these vaccines can be the cause of abortions in naive animals or animals that haven't been vaccinated properly before pregnancy. We need to be very careful about what vaccines we're giving to these pregnant animals and the effect it can have on the fetus. So pregnancy status is another one to be very concerned about, thinking about the safety and the efficacy of our vaccines. One more that I want to talk about is what we call stacking vaccines. So this is giving many different vaccines at once, which we think about being a good thing in some cases because you're decreasing the stress of handling these animals multiple times. However, as I mentioned way back in the beginning, the immune system has to work to create immunity in response to these vaccines. So twofold effect of stacking vaccines. The vaccines just may not work as well if it has to respond to too many antigens at once. Or in some cases, we can actually see an impact on safety of these vaccines. So animals can have reactions to giving too many vaccines at one time. Another thing that we need to keep in mind when creating our protocol, so that we're doing our best to minimize shoot runs for these animals, but ensuring that we're giving vaccines that can only be used safely together at one time. So when we think about vaccinating our mature cows, some of our key points here. Again, back to that fetal protection. We want to ensure that we're giving a vaccine that's going to offer good fetal protection against BVD for that entire gestation. We want to choose vaccines that are going to provide reproductive protection against IBR, also through that entire pregnancy. And thinking about the pregnancy status and timing of our vaccines, so that we're giving that vaccine to offer the best protection when we need it the most in that developing fetus. Again, I'll come back to this slide because if you only wake up for one slide in this presentation, poke your neighbor right now. This is the one they need to remember. Going back to your veterinarian on at least an annual basis to discuss your vaccine protocol is going to be your best bet. Tailor it to your operation, to your specific challenges for your herd. To wrap it all up again, working with your veterinarian at least once a year to set that vaccine protocol to ensure that it's targeted for your specific animals, the specific pathogens for which your herd is most at risk, and that we're offering the best protection for our herds. Think about vaccinating that young calf. It's important to start them off early to build a strong foundation of immunity for their lifetime. But remember that there is some unique challenges to vaccinating that young calf and to their immune system that we must think about when we're crafting those young calf vaccination protocols. And when we think about our cows, think about in a lot of cases, particularly with that viral vaccine, we're thinking about vaccinating that cow in order to best protect that calf she's going to put on the ground for us. I think I wrapped you up a little bit early here, so I'm happy to take any questions you had, but...
Any questions for Dr. Erickson? Lori's on the run. Put your hands up nice and high.
On the vaccination for a newborn calf, the Enforce 3 and the Bova Shield one shot, how soon after birth would you give that?
The Enforce 3, okay, so my standard answer will always be you should consult your veterinarian to talk about setting your specific protocol, but the Enforce 3 can be given safely at any time. So many people are giving it at their processing of their very young calf. So if you're catching that calf after birth to tag, castrate, any of those, Enforce can be given at that time. It can also be safely given later on. So some people will use it at spring turnout time. Some people will use it bringing calves into the feedlot. It's a very versatile vaccine. Bova Shield Gold one shot is more so looking at spring turnout time. So calves about 6 weeks, a little bit older than that. That would be a more targeted time in which to use that traditional injectable vaccine.
I'd stand up, but I'm afraid of heights. If I had BVD in my herd last year, to get a hold of slowing it down, sounds like I need to vaccinate before the bull goes out. Is that correct? Before pregnancy?
Yes, that would be
Okay.
the optimal time. A pre-breeding vaccine is going to give you very good immunity in that first part of pregnancy. If you're using a modified live vaccine pre-breeding, so the Bovishield Gold FP5, for example, that's going to have a full year duration of immunity. So you are going to get protection for that full year, but your strongest immunity is going to be shortly after you give that vaccine, which, as we saw in that chart, is a very important time for BVD. If you have some PI animals in your herd, it's not going to cure that.
Right.
They will still be there, but to offer best protection to the rest of your herd, pre-breeding is an optimal time to give gestational protection throughout that pregnancy. And you want to go, again, so you want to give yourself enough time before breeding for that vaccine to work. So approximately 30 days prior to breeding would be the label indications for giving a modified live vaccine, such as Bovishield Gold FP5.
Okay, I skipped that one. That's bad. So I go on, and I'm going to have some calves on the ground that have a problem. Can I hit them then in the nasal, or is that not going to do anything?
You can give Inforce at that time, but BVD is not contained in an intranasal vaccine. That is available at this time. So there is 3 viruses, IBR, BRSV, and PI3, that the intranasal Inforce 3 offers protection against. BVD is not one of them.
Okay. If I get rid of the others, is it going to help possibly if there's more than one kicking around?
So do you mean like testing your entire herd?
Yeah.
So if you care to go through and screen your entire herd for PI status and getting rid of them, that's going to go a long way to breaking the cycle of this virus in your herd.
Okay. Anything, you're out west, you've probably seen some mycoplasma. Is there anything that's going to come out someday to help protect against that?
I've had that question once already today. So
Okay.
yes, we do still see it. No, unfortunately, we are no closer to anything commercially available in a vaccine in that regard, to my knowledge. So.
But you're trying, right?
Everybody's working on that one, I think. It's my retirement plan.
Dorothy, as a feedlot operator that buys in weaned calves, whether they're calves to be backgrounded or yearlings, assuming that they've received the protocol that you've suggested, everything's been done right, how should I raise those titer levels to give me the element of protection to take them through to finish, whether it's a 200-day feeding program or 120?
Okay, so great question. So when we're looking at addressing that feeding period for those animals, I will say, to back up slightly, we always want to think that those calves coming in have gotten a protocol such as this, but we can't guarantee that. So we basically, unless we know the source of the animals and know that they're pre-vaccinated, we're always going to want to assume that we're starting off with a less than optimal immunization protocol in the past, and that we want to do our best for those calves going forward. So you have a few options. If we're looking at the best duration of immunity, you're going to want to go with an injectable at that time, and that's conventionally what's going to be done. So a product like Bovishield Gold One Shot is going to offer you protection against your viral pathogens as well as Mannheimia hemolytica. That's going to set you up with a full year of immunity. In a feedlot setting, you will sometimes see a greater challenge level than we would have seen in some of our licensing studies. And so in southern Alberta, it's quite common to go back in with an IBR vaccine, for example, to booster that in certain cases. So that's something that your veterinarian can work with you to recommend if that's going to be an issue in your area or with the cattle that you source. But most commonly, with our fall-placed calves, we're going to go with a 5-way injectable with or without Mannheimia in order to offer that full protection for the feeding period.
Question back here.
So the scour vaccines that you administer to the cows pre-calving work great. If your calving intervals spread out though over, say, an 8 or 10 week window, if you're looking at something to administer to the calves after they're born, is it calf guard you can do orally with the calves versus the bolus, or have you seen one work better than the other?
So calf guard is a Zoetis product that can be administered orally to calves after they're born to help decrease the incidence of scours. If I had my choice, then scour guard injectable is always going to be preferable, as you mentioned. But no, I don't have any comparative data between the oral products that are available on the market that are given after the animal is on the ground.
Any more questions? It looks like everybody's satisfied.
Great,
very
thank you
much,
guys.
Dr.